Diabetes is a great microcosm of kind of a whole cluster of conditions that all relate to those same risk factors. By no means does everybody that comes through, they don't all reverse their disease, but even if you don't reverse it, you can still really improve quality of life. I'm Joshua Mann, and I'm the department chair for the Department of Preventive Medicine at the University of Mississippi Medical Center. Lifestyle medicine's a significant portion of our departmental footprint, and we've been in that space almost 10 years now. With type 2 diabetes, the most common mindset has always been you get the diabetes and then we prescribe medicines, normally pills, right? And then you take those for a good long while. You try to change your diet and exercise. And then at some point, the pills don't work anymore and you go on insulin, and then on and on and on. And that's kind of the traditional mindset around diabetes. Now that, honestly, even within kind of the non-lifestyle medicine, within the more traditional house of medicine, that's changed some because of some of the new medications that have just come out in the past few years. Of course, we started our journey before those were available like they are now. Even with those, you need the lifestyle change to be effective. And so we really just wanted to approach it with a different frame of reference, that we're not trying to manage the disease, we're trying to reverse it. We've seen it happen. It takes a real commitment. Most people have a general knowledge of, okay, I need to eat better, I need to exercise more. Most people don't have a great idea of how to apply that in their own personal situation. But the other thing that's so important is the behavioral side of that, and basically having someone who's simultaneously encouraging you and kind of holding you accountable. So those are kind of the supports that we are able to build in. If a person substantially changes their diet, substantially changes their physical activity patterns, they really can reverse it. Now, the earlier you are in the pathway, the easier that is. It's a lot harder when you've been a diabetic for 30 years than it is if you've been a diabetic for 2 years. But the people that come through that really buy in and implement and sustain those changes, they will see substantial improvement. In some cases that means reversal, in other cases it just means much better glucose control, but also better quality of life. And that's one of the really great things about the lifestyle medicine approach, is even if it didn't actually change your disease outcome significantly, you still are going to have a better quality of life and lower risk for all sorts of other conditions if you exercise more, sleep better, have less stress, eat healthier, all those things. It's a cluster of things that are sort of a silver bullet that improve every possible outcome. Even if your diabetes didn't get better at all, you're still going to be less likely to fall as you get older because you're going to have more muscle mass. You're going to be less likely to get depressed because better nutrition and better sleep and more physical activity all drive better brain health, reduced risk of Alzheimer's, all these things. So that's the nice thing, is there's really no failure as long as people are on that journey to improvement. It only leads to positive outcomes.